I just want to thank all the students for joining tonight. I have an absolute rock star here with me, Dr. Shin. I call him Luke, but he goes to Dr. Shin, rightfully so. And for the second time, he was great last time we had him on, and I wanted to bring him on again to kind of tell his story. My name is Miles Murphy. I am the Academic and Industry Relations Manager here at Aspen Dental Management. I oversee District 3, which is the schools in DC, PA, Maryland area. And again, I just want to thank the students for joining. This is an Ask Me Anything session. So feel free to ask Dr. Shin any questions that come top of mind. I see that we have some questions that you guys have submitted beforehand when you were able to sign up. So if I'm looking over to my screen, that just means I'm looking at some of the questions, and I'm looking at some of the questions that are coming in as well. There is a question box on the bottom of your screen. So like I said, any question that you have, it is a live AMA session, so you can type those in, and we should be good to go. I also want to point out that we are offering free CE for students, for Aspen Dental doctors, and for just doctors in general all across the country. It is aspendentalce.com/welcome. So all you have to do is go in and sign up, and you'll be able to dive into some of those courses. It is absolutely free. We've gotten some amazing feedback from it. So without further ado, I am going to go ahead and let Dr. Shin introduce himself, and we're going to dive into some of these questions. Thank you again, Dr. Shin, for joining.
Hi, I'm Dr. Shin. I'm an associate dentist in the Maryland state for all the Maryland current Aspen Dental dental offices. I graduated from Maryland Dental School, so if there's anyone who's from Maryland Dental School, welcome. You guys are welcome to ask any questions.
Great. Thank you, Dr. Shin, for introducing yourself. I'd love to have you on because you are a recent grad. You just graduated a few months ago, right? Less than 6 months ago. So you'll be absolutely relatable to the students, and it's gonna be a pleasure. So let me dive into some of these questions. So our first question that came in is, when you were a student at Maryland, let's say specifically your D4 year, why did you choose Aspen Dental? Why did you decide to go the DSO route?
I was actually interested in just looking into private practice right away because I already have my specific experience in hospital setting, and then also I was not really interested in doing another year of residency. For me was that I was able to do some procedures that my faculty members in Maryland allowed me to do. And then I was very interested in implants, and then I was very interested in other procedures other than bread and butter dentistry. So I looked at different private practice options. I looked at other DSOs. I'm pretty sure in Maryland we have Dental Dreams, we have Smile for Kids, and we have Aspen Dental. Aspen Dental was fairly new. They started 3 years ago in Maryland, and I was really interested in that. So I decided to just go up to Boston because at Aspen Dental, they had this event. I know that it's now everything is virtual, but they have the Aspen sessions where they invite dental students or the residents to come talk to the owners. So I went up there actually exactly a year ago. I got hired. I went up to Boston because, I went to college there. And then I met to Dr. Gupta, who's the owner of all Maryland offices. And then he talked to me, and then we had an interview for an hour. And then he was talking to me about what kind of plans that they have in terms of new offices in Maryland. I was like, okay, I'm interested. So he extended me the offer in 2019, October, and then I took it. And then I just went with it because I was like, you know what, this is my first job. I'm gonna get experience either way. And Aspen has all the support systems I wanted to get as a first dentist that I can do. Because if you're in private practice, you have to figure out other auxiliary stuff besides your clinical stuff that you have to do. And then I like the fact that I have a support system from everyone that I work with. And then I just want to focus clinical work. And then that's what I'm exactly doing. So I'm kind of happy that I chose this route.
Great, thank you, Dr. Shin. I mean, that's always a question that the students have is, why did you choose Aspen Dental? Like you said, there's so many other options out there. There's private, there's other DSOs. You were lucky enough to experience our vibe session last year that was in person. Now it's going to be virtual. It's on November 7th. And like I was telling you, I think it was a day ago, it was like you were lucky to be able to experience that. And you were actually one of the like you were a early signing in your class, right? Like you signed in October, you know, like a lot of D4s kind of, they kind of wait it out, right? Like they wait to see what their options are. And you just fell in love. You fell in love with Dr. Gupta. And we'll go into the Dr. Gupta and his support a little bit later, but that's great. And thank you for telling your story behind that. So let's dive into another one of these questions regarding Maryland. So you said that you wanted something in Maryland, and now you are in Maryland, right? You went to school in Maryland. So when it came to location, what does the location look like for you? How important was location from a geographical standpoint to you when you were making your decision?
So I definitely want to stay in Maryland State, but anywhere near around here. And then I was very lucky to have that offer. And then I'm very grateful for the job that I have, especially with the COVID-19. I know that it can be very, unpredictable where you're going to end up when you graduate and then have a job. And then for me was that I really wanted to prioritize Maryland. So that's why I decided to meet with Dr. Gupta. But however, if you're a new grad and you want to experience more things outside, I think that I would have chosen other state as well for a comfort level outside of my comfort. Because no matter where I go, like I will be practicing dentistry anyway. For me, I was lucky to get this job. And then I'm covering many offices. We have Owings Mill office, we have Abingdon, we have Ocean City, we have Dundalk, Towson. And we just recently opened Health Door right next to Baltimore. We have Glen Burnie. We are actually opening up Westminster next to Frederick in Maryland as well. So it is expanding. We are definitely not, shrinking in our size. We're actually expanding well into the next year. So there will be plenty of opportunity in Maryland. So if anyone from Maryland want to, kind of get in the idea, like I'm here for you. And also in terms of that, I would just say that I love it. I'm able to learn so many things from covering so many offices. And I have my own home office. My home office is Towson. So I will spend most of times there building my column. So you will be able to, manage your schedule in home office as well.
That's great. And I just want to point out that you were one of the lucky ones to kind of be in the facility that you wanted to be. I know that location is really, really important for students, whether they have a family, a significant other, whether they're just from that town or city or state. And just speaking with students on an everyday basis, I realize how important location is to them. And I'm absolutely glad that you got the location that you wanted. So I just got a question that came in regarding GPR and residency. You mentioned that you didn't go to residency, you started working right away. So what do you recommend to a student that is unsure whether they want to go to residency or they want to start working right away? Because as you know, like we're in difficult times right now with COVID. I speak to a lot of students and they say like, hey, like my clinic is a little bit different now. Either I'm not in clinic or I'm not seeing, the same amount of patients or the patients that I should be seeing. So what is your recommendation for someone or student that isn't sure if they should go to a residency or not?
So you definitely want to get in touch with the people who have done the residency or who are currently doing residency. So if you know anybody from your dental school or from like class like a 2020, then you definitely want to reach out to them about their experience so far. It really depends on each program. So my friends in New York, they do extensively, but also their program clinic setting is altered. So my friends in the GPR in the Colorado, they're not seeing any more than like 5 patients a day, which is not exactly what you want to get out of your experience as a new grad. So it really depends like what kind of things that you want, but I would say that then like sometimes you have to be baptized by fire in any situation. So whether you start the residency or private practice, you kind of don't get the 100% feel until you start yourself. If you're unsure about it, what I would recommend you is really dig into the research. Like, talk to the people who are working in Aspen Dental in private practice. Talk to the people who are doing residency in GP or HD. I do not regret my decision not doing HD or GPR because I treat this as like my own like little more paid GPR program. Like I am able to get all the doctor support. We have 27 doctors in our group chat that answers all of my clinical questions. We have, all this extensive network and Cs. So like I've been taking endo Cs for free. And also I'm getting implant training on the side. There will be around 80 CE credits by the end of next month. So like you will not be missing all these educational opportunities. And also I usually work with another doctor who has more experience than I do. So like if I'm stuck on something, they look over me. So it's not like, you will be thrown into the wild right away. I like that as well. So it really depends on like how you want to manage a first year out after dental school. But also sometimes when opportunity presents, you definitely want to grab it, and which I did. Like I grabbed it. Yeah.
Great, thank you, Dr. Shin. I like how you mentioned you touched upon a couple points here. How you didn't go to residency or GPR, but you're still learning, right? You're still I consider you fresh out of school, right? Like you just graduated a few months ago, so you see this as kind of your learning curve and learning from your lead doctor in your offices. And I kind of want to transition to the next question that we have here regarding your work schedule and your workload. I know that you did mention, like the 5 patients a day, which is kind of low compared to you being a real life dentist in the world of dentistry. So what does your workload look like on an everyday basis? I know that you did say you are traveling to multiple offices. I know that your workload may be a little bit different, and it may vary per office, but generally speaking, what does your workload look like?
My workload daily right now as an associate who has been experiencing a lot more, and my training has accelerated quite a lot because that's why I'm able to see a lot of patients. So first month, I'll tell you that my daily workload was around 5 to 7 patients. So a few of them will be procedures like a fillings and crowns or extraction, and the other one will be dealing with their dentures and or delivering dentures or general dentistry wise. That for me it was comfortable because I want to see more patients. And as as the time progressed, into the next one and next one, I was feeling more comfortable. So currently my daily ones, I would just say around average 15 patients a day. And sometimes I will share that patient with assistants. So some things you don't have to do. So I will have my extended function DA. Sometimes we have that. So my DAs will help me to run overflow for denture patients and adjusting them, and then doing all these side things together. So I'll be charging out that about 15 to 20 patients a day currently. But then when I started, it was not like that. It was around the 5 to 7, which I liked. And then you can always request to build it more. So you can tell them oh, I want to see more patients. I want to see more patients. I'm getting used to this. Then you do it. And that's what I liked about it so far, is that I was able to kind of go at my own pace. I can say no, you don't have to overdo yourself, and I like that. So right now I'm very comfortable doing that number.
Great. And yeah, I like how you mentioned this is a typical fear for a lot of students that Aspen Dental overtreats, right? Like we throw you in the fire, and we make you kind of work at a pace that we want you to work and not that you're comfortable with. But you see as a firsthand account that hey, I came in and I was able to kind of work my way and get acclimated, to my level comfortability. So it's great that you mentioned hey, I started at 5 to 7 patients, and then I make my way to 15, maybe 20 a day. So that's awesome. And I kind of want to transition to the next question here regarding your support system in your office. What does that look like? I know that you did mention you have a lead dentist in your office, that I could imagine, works sees a little bit more traffic than you do, and helps more patients, and works a heavier workload, but they're still there to answer any question that you have, and kind of help you with specific procedures. So what does that level support system look like in your office?
It's actually very systematic, which I like, so that I can just have to tell my office manager or lead DA and lead dentist, this is what I'm comfortable of. So like, I went through the new doctor orientation where I can set my own schedule preferences and clinical preferences. So I will tell to the office manager, like, okay, if you're going to do a filling appointment with me, I need this much time. So they will have recommended time, and I'll set my own pace. So they will build a schedule around my pace I like at the beginning, and I can alter that later as I go. And then I tell my lead dental assistant that like, this is what I want in the room when I do specific procedure exam, and then they will set up that for me. And my lead dentist, like when I don't feel comfortable, like if I'm confused in the treatment planning, because I do a lot of treatment planning per day, which like you will get better as you do it. If I'm like a little confused about what to do with a specific tooth or like a treatments, and like, what is the best thing that this patient needs, then I can always ask my lead dentist, like, okay, like I'm stuck here, like I don't know how to treatment plan for this patient, meeting their demands, and what is the best thing that we can do for their dentition. And then like I said, they have a 27 doctor chat, and then I can always throw in there, and then they'll answer me with a question I feel comfortable following through. So it's very systematic. They set you up right away, and then all you have to do is pretty much ask. Like I think that the best thing you can do is don't be shy about where you are. You can just be honest, and then they're trying to work with you. And then with the system, you can only get better. Like as you see more patients and do procedures every day, like you will feel yourself, okay, I'm building my confidence. So I did it like today, like I did 3 crown delivery, I did like a wisdom tooth extraction and denture delivery. So, to get there, you have to be honest, and then they actually understand where you are.
Yeah, that's great, and thank you for kind of going over your everyday. I know it's kind of important for students to kind of gauge and see what that looks like once they graduate. I want to jump into a question that is really, really important and is on the mind for every student. It's about mentorship. So I know when you were a D4, mentorship was important to you, and it's something that you were absolutely looking for. And especially not going to GPR, right? And not doing a residency. What does mentorship look like at Aspen Dental? I know that you kind of touched upon the doctor development a little bit. And I want you to kind of elaborate on that, Dr. Shin, on what does the mentorship look like for you? I mean, like I said, you're only a couple months out. So how does that look like?
I have mentorship every day. I have so many doctors I can talk to, and then you can, there will be favorite doctors you can always go to in among all these doctors that you work with. And obviously your owner dentist, like owner dentist will be there for you to answer any questions. And if there's issue, you can always bring it up to them. Like, you don't have to like everything you do. Like that's the job. But, and then you can always talk to them honestly. Like I have my favorite doctors. I have one in Towson. The other doctor, Dr. Bindu, she's amazing. She's also part owner. She practices in Ocean City. She lives far, but she's just a phone away. I can just call her up. I can text her and like, hey, doctor, I have this questions. Like, what is the best thing to do in this situation? They'll be like answering right away. Like as soon as they are able to. And then I never feel alone because of that. Like that's one thing that I wanted to get out of this experience, was that I never want to feel like I'm left alone with my own devices right away. And then, I always have support system either by phone or in person. So I never felt that way. So there some days it can be rough with your patients, but then I know that I have all these doctors that behind me that can get support from.
Great, awesome. I want to shift gears a little bit here and kind of talk about, let's get a little personal regarding your future. Where do you see your future with Aspen Dental? This is a good question that a student had asked when they submitted their form, because I know that this is also on the mind of a lot of students. And I always hear that the ultimate goal is ownership, and we all know how Dr. Gupta owns over 20 practices, and I don't know if you want to own 1 or 20 or 30 or 40, whatever it is. What do you see yourself owning in the near future, or perhaps just making your way up to being a lead dentist? When you wake up in the morning every day, Dr. Shin, what does your future look like, and what do you want for yourself long term?
So what I like about Aspen is that I do have option of becoming an owner dentist. And then right now, my short-term goal in a few months is to become a lead dentist in one permanent location where I can be the managing director in that one location. And then get more experiences. And then my 5-year plan that I was thinking to myself was I definitely want to be an owner dentist of multiple locations. Like that's something that I am working on, getting more knowledge from the people. Like who else then I can ask Dr. Gupta, who owns like he's about to own next year. He's about to own 40 offices. Like that's just a lot. Like, but I understand like that. Like he has his own way of dealing with it. For me, like if for next 5 years, I definitely want to be at least 2 office owner or partnership with the owner. It is possible to be a partner as well in Aspen Dental, not with another owner. And then the profit sharing is also very lucrative, so I am not worried about that. I like the fact that like I have control over my plans, so I know that I can Dr. Gupta and the territory manager I work with, and like they have weekly conversation about like what I see, but I think that for me is that I want to wait for the good timing and good location to open up in Maryland. And then I'm going to be on the front line to become the lead dentist and then build a practice ground up and then, test my limits and then become an owner in next 5 years.
Awesome. Yeah, that's great. And thank you for giving us that insight, doctor. I always hear that ownership is, the final plan. And it's great that you're actually on the fast track, to becoming a lead dentist. And I absolutely see that for you. You're a hardworking dentist and you're absolutely lead dentist material, like I was telling you before. So that's great that you kind of wake up in the morning and have that plan. And I'm sure that that's on the mind of all the students as well. So let's kind of jump into a different subject here. So you obviously choose a DSO. You went the DSO route, working with Aspen Dental. What would you say is, I know you obviously done your research, and you compared the DSO route and then the private practice route. So what would you say are, if you just want to open up the floor to you, if you want to just list a few, what would you say are a few, differences of DSO and private practice?
So DSO and private practice definitely is a dental support organization. So you will have a corporate chain that helping the DSO, and everybody knows the definition. But one thing that I can tell you is that like not every DSO is the same. Aspen Dental is not same as Dental Dreams. Dental Dreams is not same as Heartland. And then the way of running the practice is very different. Like Aspen, like they have a few differences, but they're closely similar to the private practice. So in private practices, like as an owner, if you have a private practice, like you run the way that you want, and then if you become a lead dentist or owner, you have the same rights to do that. And then you just have to get support from the corporates, and then you will get the all this calculation metrics and how to do insurances, something they're all supported through the DSO Aspen. Private practice, you kind of have to learn to code as well. So that I would say so. Like DSO, they have already system and education set up to teach doctors how to code the procedure appropriately. To build insurances. In private practice, you kind of have to follow that owner has to update the coding every single year with the associate that I found from my friends. And also like some private practices will not accept all of the insurances. And DSO Aspen Dental, we take majority of insurances. So you get to see more variety of patients from different insurances. So I'll just say that like that kind of support is a little different in private practice, and you kind of have to figure it out. It's a smaller group, so in one private practice. So I'll just say is that they're like it's a little bit, it can be lonely, but I think that some people like that. So I would say those are the only things that stands out. Clinically, I don't see much difference. We do pretty much everything like private practice would do.
Great, great. I want to ask you this question that I get from the students a lot regarding treatment planning. Are you able to, on a day-to-day basis, create your own treatment plan? Do you have any help from your MCD? I know that typically that's not always the case when when you're a D4 and when you're in clinic, and you don't get a lot of exposure to that. So what are you able to create your treatment plans on an everyday basis?
Yes. So as a doctor, a treatment plan is your rights. So no one can touch that, like not even the other managers. So it's your signature, it's your treatment plan. You present that to the patients. And then what I like about my office so far is that we have a monitor. So we have a monitor for the patient. It's in an operatory. So if I see something X-ray, I want to educate the patient, click on the monitor, it's right there, and educate them right in front of their face. And then it's my own signature. So basically, as a provider, you have a right to do that. For me, like when I started treatment planning extensively, I have my MCD, which is a managing clinical director, aka as lead dentist in Aspen. So I can ask for their help, like, oh, this is a questionable diagnosis on periodontal disease. Like, what should we do? Like, should we trying to refer to perio? Should we trying to do SRP ourselves, or should we recommend long-term treatment? Would it be like extracting with the implants? So what I like about it so far here is that I can treatment plan anything. I can treatment plan to include specialists to help make a referral to endo, perio, OS, pros, ortho. And then I am going to be Invisalign certified, so that if I see some minor crowding, I'll be able to offer that as well. And then the private like a treatment plans, like it's pretty much like extensive. Like I can go all the way up to the implant restoration if I want to, because we do implants as well. So it's like it's really within your own philosophy. You got to have your own philosophy, and they will respect your philosophy as a treatment planning doctor.
Great. Thank you, doctor. It's great that you're going to be Invisalign certified. I know that's something that Aspen Dental as an organization, we're really expanding. We have over 870 offices, and eventually we're going to have all of them conduct Invisalign and have iTero scanners. And it's great that you're already learning, the curve now, so you'll be absolutely prepared for that. I know that you did mention working with the specialist, right? Like you do general dentistry. What is your relationship with the specialist? Have you had a lot of exposure to specialists? Have you taken, maybe procedure or two in your own hands? Like, what does that relationship look like with you and the oral surgeons and the endodontists?
So we actually have Dr. Lee, who teaches at Maryland Dental School, endodontic department. He is our specialist for Maryland offices. We have Dr. Kim, who graduated from the Army program in Maryland as a chief of the oral surgery. He actually went through extensive training as well. So both of them, I have their email, I have their message, so I can always ask them about the procedures. And I usually try to tackle bicuspid to bicuspid root canals. If it's like a molar and extensive and patient needs it right away, then I will talk to Dr. Lee about it. If I've seen a lot of, apical pathologies, and Dr. Lee is always there to answer questions, and if I see anything. And Dr. Kim does biopsy, so he will do also tumor removal. He will also do some IV sedation, so I can always ask him. So it's really like working together relationship. So I will have my column while they're running their column, so we'll be in the same office, and I can always ask them questions while they're going through something. And then the other specialists, perio and ortho And plus, we try to have a working relationship in the private practice around us. So Towson, we have all three of them nearby us, and we're trying to work together. So we were trying to refer them out. Like this is something I want to clarify. Like, as I was working, a lot of times people think DSO will trying to over treatment plan. It's not really that case. Like for me, like I treatment plan the way I want. If a patient says, oh no, if I don't know if this cracked filling I can afford to do crown, okay, I will rebuild for you, and you come back if you have another issue with it. And I'm trying to modify my treatment plan with the patient's needs and demands. It's never like that here so far, and it's been working. So that's something I'll just say as well. But my specialist relationships, like they're always there to answer questions. I try to do like within my limits some procedures, including some wisdom teeth and more, the bicuspid endos.
Great, thank you, doctor. I like how you mentioned that like there's a negative perception out there with DSOs, Aspen Dental, and DSOs in general, that sometimes our doctors overtreat, and there's goals, and and I like that you kind of gave that answer as like a rebuttal, like, hey, like I'm living this, I'm performing dentistry for Aspen Dental every single day, and this is absolutely not the case. Like I'm doing my own treatment planning, and I'm doing right by the patient, and I'm providing comprehensive treatment that's best for the patient at the end of the day, and I'm not overselling, quote unquote, or whatever the case may be. So we have an interesting question that just came up, and we're going to stay on this topic here. Do you ever see yourself placing implants or taking CE regarding implants? And I know implants is like the cool new procedure that all of like the general dentists want to do nowadays. So do you ever see yourself saying like, hey, this patient they need implants, right? And I'll do it myself. I don't have to refer it out to the OS. And what's your take on that? And what do you see your future placing implants?
It's funny you guys are asking that question. So we have implant continuum conferences. So we have a part 1, 2, 3, and that gives me about 80 CE credits for free. So that will be part of my journey as an Aspen Dental dentist. So once I do all 3 parts, I will be eligible for the Chicago trip. So there is an annual Chicago trip we're trying to do for implant surgery education. So we will spend a couple of the days a week learning about implant surgery, and we do hands-on exercise, and then we would place implants on patients together with an oral surgeon. We work with Nobel Biocare. I don't know if you guys are comfortable with that company. So Nobel Biocare supplies implants for Aspen Dental, Maryland. So I know the rep, and like he comes to extensive implant restoration, like all on 4, so that they will get plenty of help. So for me, I know that our owner wants all general dentists certified for implant surgery by 2022. So I will be on that journey to be able to do extensive implant restoration and learning about implant surgery within 1 or 2 years.
That's awesome. That's a great story. I mean, I hear from students, practicing dentists, that like, hey, like I want to do implants. Like that's something that I really aspire to do. And I know that knowing you're always taking initiative, and in the next couple of years you'll be able to place those implants. So that's great. And that's a great question that came up. I want to thank the student who asked that question. Let's shift gears a little bit here. I want to stay within the realm of your everyday and in the office, but we're going to touch upon the topic of COVID, right? So I know that nationwide, worldwide, every dental office and just everywhere in general is they're going through COVID and specific procedures regarding COVID. How did COVID affect your office and or offices in your case, and what are some of the precautions that you guys are taking on an everyday basis just to make sure that the patients are safe, you're safe, and everybody else is safe in that office?
So we follow the CDC guidelines and ADA guidelines for dental practices to the T. So we will have to wear N95 for all providers. Any aerosol generation, we will have to wear the jacket, gloves, and face shields. And then Aspen will supply all of the PPE for me, so I don't have to worry about that. And then the one thing I would say that like all the patients are aware. So we have systematic education for appointments. So if there's a dental appointment coming up for them, they will get notification to make sure that they bring the facial coverage, and then also that they have to be measure all of their temperatures and report any symptoms they have. So they have to fill out the form every single time they have an appointment. And then all the providers and other workers, when we come in, we measure our temperature, we record that down. So we have the log, and then the all the employees are like we are kind of like required to report if we were near any patients who was exposed to COVID-19. If we show any signs of symptoms, then they will not trying to make you come to work. So we trying to do as much as we can, and then trying to create a safe environment. Because like, in dentistry, you will also get patients who are also immunosuppressive, and then also people who are not really quite healthy. So we're trying to be careful. And then we do have rooms that we can isolate. So we have doors on some procedure rooms, and we close that down when we do any aerosol generation. Especially like a surgical extraction or fillings and crown prep, we're just trying to close the door so that we don't, create that. And we disinfect each room like very thoroughly every single time we do anything. Yeah.
Great. It's awesome that you're practicing safe dentistry. You're keeping yourself safe. You're keeping the patient safe. I know that's a big concern for students and dentists worldwide. So thank you, Dr. Shin, for giving us some insight on that. I just have a question here regarding compensation. So without giving any numbers, without jumping into how much you get paid and jumping into the specifics, what does the overall compensation structure look like at Aspen Dental? I know that you touched upon in the beginning of the session the profit sharing. So if you want to just kind of reiterate that a little bit and kind of go over what your compensation structure looks like, again, without going into any numbers, just giving us a general overview and touching the surface a little bit.
Yeah, so all the doctors have a daily guarantees when you start as an associate, and then it really depends on the owner. So the owner and then Aspen will set the compensation package, depends on the demands. And then for me, because like as an associate, you can take about good amount of, not too much, but like good amount of overproduction. So we have daily guarantee, we have each budget. So if we go over that budget, we take profit sharing the percentage of it. So I like that because like, some days I don't do well, some days I do really well, but like, no matter what I do, I have a daily guarantee. So that was very important for me as a new grad, because I wanted to have that safety net financially, because as you know, the dental school loan is like crazy. But I'm able to do that. And also like as you do more procedures, like you will see that they're like, okay, they're going to give you more later. And then as you become a lead dentist and partner or owner, the profit sharing increases, of course, because you get to do a lot more, and you have your responsibility is a lot more than an associate. So that's something to look forward to. So I would say that it doesn't get worse, it just gets better. And then you make more as you put more work into it.
Great. Thank you, Dr. Shin. That's a question that I get all the time. And I've answered that question hundreds of times on how the compensation structure looks like here at Aspen Dental, how it's different from private and other DSOs. And it's great that we have a real life dentist on here to kind of, give us an overview on what that looks like. So thank you for that again. Want to kind of jump into a day in a life when you were a D4. We have multiple D4s on this call. And I want to thank you guys for this question. What was your biggest fear as a D4? I know, you have, like thoughts going all over the place, being a D4, passing boards. It's, just figuring out where your career is going to go once you graduate, being concerned about passing your license exam and everything that goes into that, right? It's a very stressful time for D4 students, especially now during COVID. So what was your biggest fear when you were a D4 at Maryland? And how did you kind of overcome that fear? What does that like let's jump into that fear now, right? Like, or have you overcome it? Or what does that look like for you?
Well, my D4 year was wrecked by COVID-19, so I cannot really say that it'll be same for everyone. But I know that like you guys might feel like you're not getting enough clinical exposure because of COVID-19. I'll just say I would say don't worry too much about it. You do everything you can daily. That's what I told myself. I was going to um, CDCA ADAX, which is the exam that we take to get a license. When it started when I started D4 year, when I started studying for national boards, like national boards, like there are ways to really tackle that. I would recommend Mental Dental on YouTube. You can watch that video if you're studying for that right now. And CDCA ADEX, there's so many resources out there if you are in District 3 and trying to get CDCA certified. And then because of COVID-19, you guys don't have to get operative patients anymore in some schools. So Marylanders, you don't have to worry about getting patients, which I had to deal with in February. That was a little fearful because patients, I don't know if they're going to show up to my exam or not, but they did. It's a roller coaster ride. I wouldn't lie about that, but I think that you just gotta enjoy that wave. Just go with it. You'll be fine. You're gonna graduate. And then trying to do some, everyday thing, trying to get something done in clinic, trying to get yourself more exposed. Trying to talk to dentists out there like me or other dentists out there in, GPR or whatever. So like you can get more knowledge, you can get more experiences. That's the only thing I would say would get you through this whole situation. I was very lucky because after CDCA is done, our school shut down in March. And I was like, okay, so all of a sudden my patients are stopped and I cannot see any of them. I was like, okay, I guess I'm getting diploma in 3 months. So I didn't do any of the dentistry since March until early August when I started working. But during that time, that one thing that kept me going was that, what, I'll be fine. I will be fine. Because when you are D4, you made it. So tell yourself that, pat your, shoulder. You just have to stick to what is best for you and then trying to get to dental school as much as you can. And then, there are opportunities out there, sometimes you got to compromise, but, things are out there still for you. So I wouldn't be consumed by fear, just trying to do everything you can daily.
Great. Thank you, Dr. Shin. And I want to thank the student for asking that question as well. Like that's an awesome question, especially now, the students need all the advice that they can get because it's a super stressful time for them. And it's great that you were able to give your insight on, right? You graduated during the pandemic as well. So who's better to ask than you, right? So I want to jump into a question here regarding work-life balance. This is something that here at Aspen Dental, just as a culture, we like to really promote. We like to promote a great culture and a great work-life balance. You transitioning from dental school and moving from office to office and kind of floating around a little bit. What does work-life balance mean to you? And are you fulfilled? Does Aspen Dental provide that work-life balance?
I'm enjoying it. I love it. So far, I do have new friends in each office. I know some dental assistants that I sometimes hang out with. And then doctors, they tell me all this stuff. So it's really I think that the first thing, the attitude as an associate should have is that you just have to be open-minded. You have to get to know people. It's exciting to meet new people in private practice and Aspen. And, everybody knows everyone. So that's another thing. I would say that I like it. I come home. I don't have to do any project. I don't have to do homework. I don't have to study for anything. I finish my notes on that day. I come home and I'm I have a cat. I have a really wonderful cat. I live in the city. I live in Baltimore by choice, just for another year. And then it's been working out fine. So, in the city, I can go out on the weekend to the harbor. It's like, I like it. I think I'm enjoying it too much sometimes, but it's really fun.
No, that's awesome. And work hard, play hard, right? Like you work hard every single day, you work full time, and it's great that, you're in, the city of your choice and you're able to enjoy your life and meet new people. So that's great. So let's jump back into when you were in dental school, right? This is a question that I get sometimes as well, especially like they want to hear about like their experience from the students that graduated. What was your role like with ASDA, right? Did you participate in any ASDA events? Were you really involved with ASDA, or were you one of those students that, you heard about it and you obviously know about it just like every other dental student in the country, but you didn't really kind of engage in ASDA events? Or were you that student that went to, every ASDA event and was super engaged with Maryland? What was your experience like?
So I was part of ASTA, and then I got really busy in fourth year, so I really kind of stopped. But yeah, I was a social media chair for Maryland for 1 year during my second year, and I was working with community services chair. So I organized some community service around the Maryland to bring dental students and other people together to, like, church activities, or like, the fair. I don't know what's going on with the COVID-19's like situation for all of those, but when I had the chance, I enjoyed it. And then one other thing was that I heard about Aspen Dental because of Ask that we had an event in Pennsylvania, Pocono. So I was able to get some exposure there as well because Aspen Dental was one of the sponsors. And then I learned about it in second year, and then I was like, you know what, I'm not even D4. I'm not gonna worry about it. So but I was involved with ASTA. I loved it. I did not really get to do the national conferences, but I did local conferences, and I met amazing friends from that conferences who are, different dentists in the Pennsylvania area too. So if you're District 3, keep it up. It's really nice district. I went to their district conferences. It was really nice.
Yay, go District 3. The Poconos, I'm pretty sure you're talking about the District 3 meeting. We sponsor that every single year, and I went for the first time this January, and I had a blast as well. So it's great that you were heavily involved in ASDA. I know that ASDA means a lot to students, and here on Aspen Dental's behalf, like we love sponsoring ASDA events and working with ASDA for socials, dinners, lunch and learns, etc. So that's great that you were heavily involved, and you had a great job. You were the social media chair. Like that's pretty.
Oh yeah, I forgot to mention the ASTA National Vice President, Dr. Mitchell. He's one of my best friends because I started working with ASTA, and he was the vice president. So he's working in Pennsylvania Aspen Dental office as well. So yeah, I have a really good relationship with him. I text him all the questions. So I'm grateful that I was able to do all these fancy events.
Yeah, I know Dr. Mitchell. He's great, and it's funny that you guys are friends because he's awesome. And it's great that, like I said, I knew that he was heavily involved as well, and you were involved. So that's awesome. And we got a question that came in regarding just you as a dentist. What do you enjoy the most about dentistry, Dr. Shin? And I know that every doctor has a completely different answer. And I know when you wake up in the morning, you're fulfilled by helping patients every single day, and you're changing patients' lives, right? So what would you say? If you can kind of hit the nail on the head and you can kind of give me, what do you enjoy the most about dentistry? I think that I'm even interested about on it, just as much as the student that asked the question. So what would it be?
So I think one of the reasons why I didn't specialize is because I like restoring teeth with the composites, and I like doing aesthetic dentistry. So I will do veneer composites, and then works when I match the shade spot on patient, I can see them smile. They're like, oh my gosh, I can smile with my teeth showing. There's no other feeling like that. You literally change that person's life for the years to come, and then that just what I chase every day. Like, like another thing, I know it sounds weird, but when patient has diseased teeth and I pull that out and I clean that socket out, it's like, oh my gosh, it feels like I just popped the zit, you know? So I love working to, solve people's problems. That's always been my calling since I was little. I love helping. And then what better ways than to help patients to get them out of pain and then give them new smiles, and then you give them new dentures to really chew and eat, like speak and smile, and then you get paid. So that's the those are the two combinations you cannot miss. And then that's what I love about it, is that they're like, I love being a dentist because the patients that I see, they get to learn about themselves more. And then I realized that the health literacy and dental literacy in the United States is quite low than I expected. And me being one of the frontline for that specific reason, that I can talk to patients and educate them. I actually have time in Aspen Dental to sit down and educate the patients. This is happening in their mouth. And then this is exactly why we should do something about it. And patients like, wow, I never heard about that before. Like, you know what I mean? So those are the moments I chase after every day, like educating patients, fixing their smile, giving them something to look forward to, and then having them out of pain. That's what I love about being a general dentist so far.
That's great, and that's an amazing answer. I know I kind of had a feeling that, you just knowing you as a person, right? You love to give back, and you love to kind of change lives. And I want to kind of stay on that topic, but on the other side of the token. So what do you find the most frustrating in dentistry? Don't say nothing frustrates you, because I know that there's things that might frustrate you, just like every dentist in the world. What would you say frustrates you on an everyday basis, Dr. Shin?
When procedures don't go the way I want. Sometimes not every filling will be the way that it should have been, or sometimes when you look at it and you want to fix it, and and also like the frustrating part is that they're like, patients come with a fixed attitude where they will come and then talk to me like I'm sort of money grabber that just wants to take the money away from you. And then, it's like, I am not a therapist. I cannot change their mind, but like, I trying to explain and then said that no, I am not here to just grab your money and run with it. I'm trying to give you what is best for you, and you can make that work together, or you can just trying to choose what is best for you to do. So those situations, like, I think that communication wise, like, I mean, I'm still learning. So then patients like usually end up like understanding it, but like it just like that can be very frustrating when you are like, for me, like I'm doing a lot of procedure and I have the patient, and the patient comes with like the pre-notion about dentists, and they're like, it's like, oh my gosh, can you just listen to me just for a second? Yeah, that, like, I think comes with time to like relax yourself, but that's still a little frustrating when I deal with that.
Yeah, I can imagine. I know that, you want everything to always go perfect. And I know that it doesn't always happen like that in dentistry. That's great insight. I can imagine. So I want to ask you about, we're coming up on 5 minutes here. Um, I, I want to ask you about, like we said in the beginning of the session, how, you obviously are with Dr. Gupta, and he owns, so many offices. You said he's going to be pushing 40 soon. What is your relationship with him? Is he there? Is he ever there to help you? Is he a phone call away? Is he ever in your office that you're working out? Like, what is your relationship with him? I can imagine he's such a busy man, right? So can you kind of just give us an overview on you and Dr. Gupta?
He's like, he's chill. He's very chill. Maybe that's why he can own there's so many offices. But one thing I can tell you is that he knows how to see through you. Like, he has a lot of experience with so many people. He understands you, and then I have WhatsApp app. So like WhatsApp, like I can add, like he added me to the Dr. Chen. He added me personally. So he checks on me. Actually, I saw him yesterday in person. Like he was just traveling to different offices to check on us, and he really checks on his own associates. So I'm the current, there are only 2 associates in Maryland so far this year. And then he would check on us, both of us, like, you know, hey, how are you doing? Like, do you need something? You know, like, so I'm very chill with him. And also like, I don't get intimidated easily. So I will say whatever I want. And then like, he understands that too. So like, you know, so like we have a good working relationship. Like he's very chill, understands you. Like he knows when you're motivated, you want to do something, he wants to make that happen. So, and then that can be a great support because he has so much influence. So like if he wants to push it through and like, and then do it, he's there. So like, I also like understand he's busy, but he's just on rich away. Like I can ask him anything. I'm pretty sure I can text him now. He will respond in like 5 minutes.
That's great, and I hear that all the time about Dr. Gupta. That he's very supportive, even though he owns so many offices. He's always there. He's always a call away, a text away, etc. So I want to. We're coming up on a couple minutes here, and this is we're gonna make this the last question. And I think it's a very interesting question. I actually want to know the answer to it as well. So you live in Baltimore, right, Dr. Shin? Do you ever see yourself moving out of Baltimore and going to a different location within the Aspen Dental Network or somewhere else, or whatever the case may be in the future? Are there any other states or locations that you're interested in that you've thought about? I know your heart's in Maryland, and you know you're in Baltimore and where you want to be, but is there any other locations that come top of mind that you would say like I would absolutely move there?
So other than Maryland, like I'm considering like Pennsylvania or even California. So I know that we are trying to push through the West Coast too. So
Yep.
if there's any opportunity there, I will take that. So far, I don't have really plans outside of Aspen Dental because I know that there are key booming locations in Maryland. We're trying to get the real estate deal to build a new office in the next year expansion. So I am considering to take one of them. So not so soon, but if there's anything that I want to move away to do it, then I'll do go like, you know, into the, you know, little bit more demanding area. I am not really city person. I am not I'm not like, I don't have much preferences. I just want to go where I'm needed much. But if I have an option, yeah, I'll rather to stay in Maryland, but I know that there are many opportunities in Pennsylvania area and then Virginia and DC. But like right now, I'm comfortable where I am in DMV area.
Great, awesome. Thank you, Dr. Shin. I want to give a big thank you to you for participating in our AMA session tonight. You've gave some amazing answers. You are a complete rock star. I always tell you this. I truly believe it from the moment that I met you. I want to also thank all the students for not only joining, but asking some interesting questions. I know that you guys learned a lot today. I learned a lot as well. So I want to thank you guys for that. I think that it's a great time to end here. If you guys have any follow-up questions, please feel free to email me at miles.murphy@aspendental.com. Or if you have any questions for Dr. Shin as well, feel free to reach out to me, and I'm going to forward them over to him. And I want to thank you guys all again for attending. Everyone stay safe. Good luck in school. Dr. Shin, good luck in your dentistry journey. As happy Friday, right? It's tomorrow's Friday, and enjoy your weekend, all the students, and good luck on boards and everything that you're going through as well. And I'll talk to you guys all soon. Thank you, Dr. Shin.
Bye.
All right.